Relations and a corporate officer at the NYC Health Hospital Corporation. And I've heard LaRay speak on several occasions. She's really a great speaker. She knows so much about the issue of health care. Tonight we're focusing on the closing of Goldwater Hospital, what's going to happen there. But I think LaRay could talk on any subject of health care, and we'd all be very interested. With her tonight is Floyd, who is the Deputy Executive Director of Goldwater Special Hospital and Nursing Facility. He also will tell us what's going on in his hospital in terms of closing it and finding room for all the patients who are there. Okay, so LaRay.
Sure. And Floyd, if I get something wrong, you will help me. So we were asked to come this evening to talk about our plans for the Goldwater Hospital and the time frame. As many of you know, we are building a new skilled nursing facility. So, as many of you know, we, the New York City Health Hospitals Corp, are building a brand new skilled nursing facility and long-term acute care hospital up in Manhattan at what had been the North General Hospital. We will, in fact, have that project will be completed by September, early October. And when I say it will be completed, it will be literally ready to receive patients. Our plan is to actually relocate more than 300 patients from Goldwater to that new facility during the last week in October of 2013. This October 2013, there will be patients who are at Goldwater now who will not be going up to the new facility. Those patients or residents will be transferred to the Kohler campus. We still intend to operate the Kohler campus, and our new Goldwater, which has a new name, the Henry J. Carter Skilled Nursing and Rehabilitation Center, will be our replacement for Goldwater. We have been planning for a replacement facility for now, I want to say almost 10, if not at least 10 years. We talked about it might have been at least 5 years ago. And the principal reason that we had planned for a replacement facility I was sharing was that the Goldwater campus was actually designed in the 1930s, built in 1940. And as you can well imagine, there have been a myriad of changes in how healthcare, and in particular how long-term care is provided from that period of time. It is a very old facility, notwithstanding that the folks who operated have done Herculean efforts to maintain that facility. But by virtue of its age and its design, it's also very, very expensive to operate and to maintain and difficult and challenging, I should say, to continue to meet both federal and state regulations in terms of the delivery of healthcare services. We had this great opportunity of being able to obtain the use of the North General Hospital campus. The unfortunate instance of that hospital going bankrupt created an opportunity for the public hospital system to be able, with funding from the state and funding from the city, to actually construct on the campus of that hospital a new skilled nursing facility of 164 beds, and then to take the building that had been operated as an acute care hospital and essentially totally got renovated, more than we ever anticipated, the cost of more than what we ever anticipated, to create a 210-bed long-term acute care hospital. In addition, we've also worked with a private developer and the folks from the New York City Housing Preservation and Development Corporation, the State Housing Agency, and HUD, essentially to get financing for the development of 175 apartments, exclusively, frankly, for individuals who are currently at Goldwater, but for whom their continued stay at that level of care in a nursing home is not currently necessary, or won't be necessary, but in fact, they are in need of affordable and accessible housing. And so this 175 apartment development will actually be designed to accommodate individuals who have mobility impairments. Each apartment will be designed for folks who are, if they're not in wheelchairs now, who may find themselves in wheelchairs, and the entire building will be constructed to assure that folks have optimal access, notwithstanding their challenges with mobility. That project has started. I was saying that it's on East 99th Street, directly across the street from Metropolitan Hospital. It will be completed sometime at the end of 2014, calendar year 14. We'll be ready to rent up probably in early spring, or late spring, early summer of 2015. And we actually will have individuals who are at Kohler, who are with whom we are working on a transition plan, who will then become tenants of that housing development. So the combination of our building a brand new state-of-the-art nursing home, as well as a long-term acute hospital, and the housing development will enable us to replace the Goldwater facility with a smaller facility in terms of hospital and nursing home beds, but at a size that actually addresses the need for the residents and patients that we serve currently on that campus. I could go on, but I won't. What I really would like to do is to entertain questions, but before I do, did I miss anything? Was there anything we should talk about? Okay.
I didn't catch the date on when the apartments are going to be finished.
The construction will take about 24 months from this past October, the actual construction. And then there are the various requirements in terms of inspections and certificates of occupancy. So we're anticipating spring of 2015 of the, when the apartments will be ready to be rented up. And folks won't all move in on the same day, but in the spring of 2015. Yes.
Sorry, I was a few minutes late, so I apologize if you covered this, but did you say when will the demolition of Goldwater start and how long will it take?
Oh, I really did not mention that, and I also failed to mention an important aspect of once we leave, what's happening. So once we vacate the Goldwater campus, which we anticipate our residents and our patients leaving by the end of October, no later than the first week or so of November, but the end of October is our goal. The HHC will surrender the campus back to the City of New York. And then the City of New York, as you all know, has entered into an agreement with Cornell Technion to develop over several years, many years, expansive campus. So our structures will be demolished by the Cornell entity. And the timeline because they have multi-phases in terms of the development. So I can't tell you exactly the date of the demolition, but it would more than likely be in their first phase, which is in itself a few years of work. After frankly, at the end of this calendar year, the campus will no longer be the responsibility of HAC or our leadership at Kohler, although we will continue to operate our Kohler campus.
So you're talking about after this coming October, everybody's going to
within this calendar year, October 28th, 29th, and 30th is our game plan for when we will be literally relocating our patients from Goldwater to our new hospital and long-term care facility on East 122nd, 123rd, between Madison and Park. That's the location of what had been the North General Hospital. We will also, within a week or so of that time, relocate some of the nursing home residents who will be going back in some cases or to Kohler, our Kohler skilled nursing facility. So we will have two distinct moves. By the end of November, well, really the middle to end of November, we do not intend to have any HHC operations on the Goldwater campus, so that we will be able to, frankly, give back the campus to the city of New York.
What happens is an administrative building's not going to be built? What happens to those people?
Well, many of those individuals are folks who will continue to need long-term care or folks with whom we're working on preparing to live in the community, and those individuals will be at Kohler. And actually, we're working with the state of New York, who has to give us approval for our relocation. Literally, there are some very strict rules as to how we relocate folks who are active patients and residents of nursing facilities, so that we can make sure that people are safely relocated to the new facility, as well as the state giving us approval for those individuals who will go to Kohler, who are in the middle of their transition planning for ultimate tenancy in the housing program.
So do you know who's doing the demolition, or that?
I have no idea who would be doing. When I say I have no idea, I do not know whether Cornell has identified a firm to do the demolition. What I do know is that they are ultimately responsible. The demolition of the campus is included in the Cornell work plan, in their multi-phase plan for the development of that campus. It's not HAC.
I think they told us that it's going to be done before they come in.
I can't imagine that demolition will be done before they come in. We are decommissioning, which is basically we are emptying all buildings, literally moving stuff. In addition to moving our patients, we're moving the things out of the building, things that are movable, beds, furnishings, things like that. We're working with a firm to help us do that, so that upon our vacating the building, it will be ready for demolition. But the actual demolition will not be our responsibility, it will be Cornell's.
Yes, sir.
Can you talk about what criteria is being used to determine where the Goldwater patients are transferred to? What criteria is used to determine if they go to Kohler or if they go to North General?
Okay.
And have the patients been told yet about the process?
Sure. I would say that we probably haven't given patients enough information. If you were to ask any one patient, they'd probably say they want to know more. But in general, the first criteria would be based on clinical need. Hospital, and that hospital includes ventilator services and other types of more intensive services. And then there's a skilled nursing facility. So the first order of business would be patients who need the more intensive and long-term acute, they would be going to the new facility. In terms of the other criteria we use, I'm going to ask my colleague here, who actually runs the place, to talk about that.
Good evening. Okay, as Ms. Brown spoke, we will start out with the acuity being the benchmark, if you will, to help determine who is relocating to Henry J. Carter. The next wave, I would say, is the move to the Kohler campus. We will make sure that all of our residents and patients have the appropriate services at the Kohler campus. And currently, we do have space. So I don't want anyone to think that we will inappropriately discharge someone to a setting that is not safe for them. All of our discharges are unique based on the resident's need, physical as well as psychological need. And we're working very closely with the resident, if alert-oriented, the family members, as well as with oversight from the State Department of Health. There are very stringent regulations in terms of the discharge process, the notifications, the timelines, and the review process to make sure that the discharge is a safe and appropriate discharge.
And I think we should add the issue of, to the extent possible, choice.
Yes.
Patient choice.
Yes, we are working with the residents. As I said, it is the discharge process itself is very individualized. So we certainly will take the residents' preference into account, keeping in mind that we do have the timelines that are necessary to be followed at this point. So we're working with all of our residents, their families, as well as the other agencies to assist us with placement.
Does that answer your question?
Yeah, in a way.
Okay.
Just to follow up, though,
Sure.
there are some patients at the hospital who are members of the community who can get out and they go to the local stores.
Absolutely.
And they're able to take care of themselves better than others. Are they more or less likely to remain on Roosevelt Island at Kohler Hospital?
I'm going to make a general statement because, as my colleague Mr. Long said, the plans are very individualized. But let's say, for the folks that you're describing who we would consider to be very high functioning in terms of being able to get out and about, etc. Some of those individuals, and in that case, some of those individuals may opt to stay at Kohler, meaning if they are still skilled nursing facility eligible, they would have an option of the new facility or Kohler. But some may say, I like being here, and we will try to accommodate their needs. Others of those individuals are actually in that cohort that I talked about with whom we're working to transition into housing. So some of those folks will go to the 175 apartments that I talked about, which is on East 99th Street. And as a matter of fact, we have engaged some of the current Kohler residents in focus groups with the developer and the architect that have designed that new apartment building, essentially, to get their feedback as to what would they like, what kind, how the space of the apartments, where literally the plugs are and things like that, and the services that would be available in terms of healthcare at Metropolitan Hospital. So I'd say to you, because folks are unique, that if you took 4 folks that you're describing, 2 might stay here, 1 might go to Henry J, and 1 might be going to housing at the new apartments, or maybe 1 stays here, 1 goes to Henry J, 1 goes to the new apartments, and between now and when the new apartments are available, we are also working with Goldwater Skilled Nursing Facility residents on other discharge options. We're discharging, we have always discharge folks every day to community settings. And we continue to do that even now. So some folks are saying, I want to go live in Queens because that's where my son lives, or other places like that.
But it would be their choice?
Well, the state requires that this is not, we can't A, discharge anyone involuntarily, and B, we have to engage the resident in the discharge plan, and I use discharge broadly, but discharge to the community or discharge from Goldwater to Kohler or as a transfer, they have to be engaged. That said, the state also expects us to identify the appropriate type of service, right? So if the person needs skilled nursing care, their options would be the new Henry J. or Kohler. If they need acute long-term care, their option would be the new facility.
Thank you.
Hi, sorry, just a couple of clarifying questions. You talked about how the new facilities, both Henry J. and the long-term housing units, the apartments are going to be funded, but it seemed like they were...
I only talked about
where the funding's coming from, right?
Sure.
So can you just clarify, is it coming from... I'm from Councilmember Lapin's office, by the way, that's why I'm asking. Hi. So I just want to clarify, you mentioned a combination of both city and state, that funding coming from both city and the state. So could you just clarify that for me?
Okay, so I'll start with the housing, but then the funding for the hospital and the skilled nursing facility are very different.
Right.
So the housing project cost is about $57 million. So housing is not cheap, right? And particularly one that is designed for folks with special needs. So most of the financing for the housing came through tax credits, and that's why I mentioned the HPD, or Housing Preservation and Development. So a combination of federal and mostly federal, but city tax credits through the HPD program. In addition, there's funding from the state. I think the agency is HCR, so Housing Community and Renewal, I think that's what it stands for. They provided funding. It's a relatively unique funding source in as much as it's funding through the Medicaid redesign team, and this was the first project funded through that mechanism because of the connection of this housing and the reduction of Medicaid expenditures, because we are moving people who would otherwise be in an expensive long-term care facility into housing, which isn't as expensive on an annual basis. So there was MRT funding through HCR. I'm using the alphabet soup, I apologize. In addition, in that budget, there is an expectation of a mortgage and rental income. I mentioned HUD because we were able to get Section 8, project-based Section 8 designation for this project, and that's what makes the housing affordable, because most of the individuals, if not, I should say all the individuals, their monthly income is basically SSI, so about $900 a month. And if we were to go with market rate housing, these apartments I failed to mention, they're one-bedroom studio apartments, could go anywhere from $1,200 to $3,000, and clearly that's not affordable. So the combination of the HUD support through Project 8, the tax credit financing, the MRT financing, I don't think we have any council money for that project.
I just wanted to check whether
No, I'm just going in my head, going through the financing structure. Essentially, those are the tax credits and the state funding and federal resource in terms of Section 8.
So it's a combination of all three?
Yeah. So that's the housing.
Right.
Essentially, we were talking before folks got here, the financing for our new facility, I did generally mention that that was a combination of state funding, and the way nursing homes are capital, or building new nursing homes are handled is if the state approves you're doing a new nursing home, they build into your rate structure, your reimbursement, what they call a capital add-on to support some of the cost, I should emphasize some of the cost, for the construction. The cost of our building the new skilled nursing facility and totally renovating the hospital building for the LTAC, that project is about $330 million total. It's expensive to build healthcare facilities. So some of the funding for that will come through the Medicaid reimbursement, but the more significant, and then we got I think maybe $30 million from the state as a grant, and then basically we got city capital funding for the remainder of the project, which HHC has to pay back as debt service. And we pay that debt service, like mortgage and your interest on the mortgage through our patient revenues. Can you speak up, sir?
I can. My name is Jack Resnick. I'm a doctor here at Roosevelt.
Oh, good.
And I have the extraordinary good fortune in my life to take care of apartments that were built 37 years ago, when 50 people were moved out of Goldwater into those apartments. People who I think under your criteria would be acute care. People want respirators, quadriplegics, people getting IVs, all that. Those people live longer and are still alive, some of them. It costs the system a fraction of what they cost. And they're the best example anywhere in the country, perhaps in the world, of what should happen to the disabled, how they should be treated. I'm struck that despite this conversation over the years, your plans don't seem to include an island where there's housing still being built, housing that could be recaptured, which went privately, that was designed and built for this population, to bring some of these people out of Goldwater into the community that is the most successful example of doing that there has ever been.
So let me just clarify something here. Some of the folks, when you said we would consider, you described some of the folks who are now residing in apartments here in Roosevelt Island, and you mentioned folks on ventilators we will have in the 175 apartments folks who actually have those concerns as well. I just sat in on a conference call where we literally were going through about 25, reviewing 25 individuals who are who are working with various community organizations around their post-hospital or post-stay, and who are going into housing in the community. And we've got folks who may need home care, either a nurse or a home attendant to help them with getting dressed because they are in a wheelchair and they're paraplegic, or we have folks who may need to have assistance with suctioning, but that doesn't mean that they need to be in institutions. So you're absolutely right, and we are working with those residents or those patients every day, and some of them who have already gone into community settings. I dare say probably some here. Your point is extremely well taken as to our plan does not include yet using any apartments on Roosevelt Island. And I would say to you that that doesn't preclude us from, in the future, because we're still going to be on the island at Kohler with 815 or so, 815 residents who we very much like to have the opportunity of an apartment here. May I finish, please? Part of our challenge in accessing apartments here is the affordability issue, right? It's like, I don't know, but maybe someone can educate me, and I'd really like to know this. If there's a number of apartments that would be affordable for the residents who are being discharged, from Kohler and Goldwater, who are poor and who don't have, again, who only get, and in some cases, and that amount ranges, but only get what, the income from being on Social Security disability. I don't know about the affordability. And how do we have any units? Because we'd be happy to work with you to identify any apartments, because we still have lots of folks who. Well, see, that's the problem. I was very specific in saying project-based Section 8. So we got.
Building apartments that were under Section 8 in Toronto that have been lost to Section 8 that could be very inexpensively recaptured.
Well, we're not geniuses, so we thought of what we had, and in terms, let me just finish. The parcel that we are using for the apartments that I described belonged to HHC in the city, so it could be developed with even though it's $57 million. There's no real estate cost there, as well as its proximity. I think you were here when I mentioned that it literally is across the street from Metropolitan Hospital, another HHC facility, and so that there's some assurance of ongoing, not long-term care, which is what Kohler and Goldwater provide, but ongoing health care services, and that would be available at that hospital in its ambulatory care clinics and through our home health services that are also housed there.
Well, in my personal experience, people that get care in that fashion, rather than the fashion of having a doctor who knows them personally, who's known them for 20 years, die much more quickly and cost much more. Furthermore, I didn't hear the beginnings, but these 197 units, they're in a single facility?
175.
175 units, they're all in one facility? They're not scattered through one.
No, this is literally an apartment building of 175.
Well, that's disgusting.
No, the people could have been necessary.
What's disgusting about it? The extraordinary experiment that went on in Roosevelt Island over the last 35 years took 50 people and didn't, warehouse them in a 15-unit apartment house. It spread them into the community. We showed, this island showed, and Goldwater 35 years ago showed what you could do with the disabled, how you can integrate them into the community. And they're a vital part of this population, and their apartments have been installed or spread throughout the community. I'm distraught that with that history, here in this city, with your organization on this island, no one, despite several attempts to get through allergies and all sorts of things, has come and talk to us about it. I don't understand it. How is it possible?
Well, let me just, before Floyd says something, I'd be happy to talk to you because we have more patients who need housing than the 175 apartments. You give me a card, I'll give you mine, we can talk. And as I said to you, we are going to need opportunities for the 815 folks as they progress in their ability, in their health care, to leave Kohler and to reside in the community. And I can say to you that I started my career in New Jersey in 1970 doing exactly what you're talking about in terms of working to develop community-based, within socially supported context, small housing for persons with disabilities. So you have no argument from me as to what works and what can work.
Were you aware of what happened on Roosevelt Island? I mean, how could it be that you had this task before you and you take what was how did that happen?
Frankly, I did not know about your wonderful experiment, but I also know that in working with my colleagues at Goldwater, when we talked about being able to find housing for folks, they weren't finding enough housing for the numbers of people that we have who need housing here that was affordable here. But I think Floyd wants to say something to Dr.
Just to close that discussion on resident, I've been a part of Goldwater for 20 years, so I am aware of the discharges and I won't call it an experiment, but the activity that occurred when Isla Town was first built in the 70s. I wasn't here, but I was aware. I think in principle, we are certainly in agreement that residents who are in long-term care settings will thrive and can thrive in the community. We've seen it here on Roosevelt Island, as well as other parts of New York City. Many of our residents actually come from or other boroughs and long to return. So over this period, we have certainly discharged in I'll call it a scattered approach, where we've looked for housing for residents in all of the boroughs. And we have been successful, but based on the fact that, and I'm going back to the principle that we are certainly in agreement, and as evidenced by the modernization project itself is a much smaller version of what Goldwater currently is. So because, as evidenced by the number of people who can benefit from returning to the community. So, I think, Ms. Brown can certainly have future discussions with you, but we in principle agree that the community is certainly a wonderful destination for many of our residents that we provide services to.
So, what I'm understanding is you were somewhat powerless to get people sticky vouchers to get Section 8 for Section 8.
I did not use the word powerless. I would never describe myself as powerless.
Okay.
So what I said was,
do the patients that want to return to the community have sticky vouchers for Section 8?
No, because the federal government has reduced the number of Section 8 vouchers that they allocate to New York. And New York City, don't quote me on the exact number, but there are thousands of people who are on a waiting list. I believe the NYCHA and HPD are the two agencies that handle Section 8 vouchers. And what I have been told and what I know is that there are tens of thousands of people who, all over the city, who are low-income individuals who are on waiting lists for Section 8 vouchers. The uniqueness of the development that I spoke about, and the reason it got basically project-based Section 8 was because, again, it was connected to the Medicaid redesign goals, policy aims, of our being able to basically to downsize the Goldwater institution to address the needs that there are people who are in that institution longer than is needed clinically, but for want of affordable and accessible housing, and therefore we were able to convince HUD to provide the project-based support for this building. It is very challenging to get individuals Section 8, not just people coming out of Goldwater. We have 3 other long-term care facilities throughout the city: Brooklyn, Manhattan, Lower Manhattan, and Staten Island. And we are challenged by that because of the people we serve are folks who don't have a lot of resources.
There's a combination question here because it's a bit astounding to me that you're being charged. I want to say, yes, you're powerless, because that was a powerless statement. I also want to say that you've got elected officials here that you could be working with to possibly broker some deal that it's far cheaper to bring somebody back to the community. You said that yourself. So the city, having half the Medicaid costs of somebody that's in a long-term care facility, which I know to be very expensive per day, that expense could be much cheaper if the city took that money and put it into an apartment. I don't quite understand how the finances work, but I do know that some creative people could conceivably sit down and do what Dr. Resnick is saying, which is figure out a way of getting them into the private apartments, the full rate apartments now that are in Roosevelt Landing, that used to be Mitchell-Lama and are now market rate apartments, recapture those apartments in some way with some deal that the city makes and get those apartments back so that some of the patients can live there.
Well, again, that is an option that can be explored. But the reality is, when you say we could have talked to elected officials, we talked to a lot of elected officials, and there were a lot of elected officials involved in this project, including the governor's office, the folks in the State Department of Health, our Deputy Mayor Steele. Deputy Mayor Gibbs is our Deputy Mayor Steele, all the people in the Bloomberg administration, various commissioners. We've engaged with council members and state legislatures in exploring how we could finance this project. And I would say to you that there are a lot of competing priorities in terms of the numbers of people who are waiting for sticky vouchers, the numbers of people who are in families and individuals who are in homeless shelters, who are waiting for apartments. So what we did was what we could do within the time frame and with the resources that we had. And as I keep saying here, there is that was only one option for housing. As Floyd has said, we have discharged many, many people to individual apartments. We've worked with the Housing Authority for folks who are eligible for the Housing Authority to get apartments. I think we have more than 50 people who have chosen to return to their communities who are in NYCHA apartments. We have other people who are who may have a little bit of resources who are moving into private, apartments or 2-3 family units. We have a myriad of housing options. The 175 apartments that I talked about was one option, and this could be another option, but the reality is the challenge will be what we can do to create the affordability. So if Dr. Resnick is amenable, and if there are if you want to get involved, and there are council members and others who want to get involved and figure this out, I'm game to do that, because we have 815 people at Kohler who will need, and we'll have more because we hope to discharge folks, but we will have people who will be coming to Kohler Hospital who will inevitably and appropriately need to be in housing, some kind of housing arrangement.
Yes, sir.
Has the extremely fast-track Cornell project, which is going to require the demolition and the construction of the new school under a very quick timetable, has that limited the options that you have had in placing these patients in the appropriate circumstances?
Absolutely not.
Yes.
Given this, the special circumstances for these patients who are possibly able to live in the community and live in low-income housing, has there been any talk or any discussions about streamlining that process? Because you're talking about the long waiting list, which we all know exists, and a lot of people are on that. Is there any way to streamline the process for these patients in terms of getting them into public housing, outside of these 175?
Sure. In fact, one of the things that we've been able to do is Goldwater actually is a priority category. People coming from Goldwater, I should say, is a priority category for the NYCHA housing. So we've actually been able to get that designation so that individuals who are, again, people have to be eligible for public housing, and income is only one of the criteria. So we have been able to streamline the process. In fact, we actually have an assistant commissioner and her team who are our point people who work with our discharge planning staff and social work staff and Goldwater and members of my staff, and literally taking, as they say, the rocks out of the road for individuals who want to live in NYCHA housing and who are eligible.
Which basically, 175 units are about $57 million.
based is for a particular project.
But does it have to fund the entire project, or can fund this part?
No, basically the project-based Section 8 designation is that each apartment will continue to be have rent subsidized. That's what that means in that building.
If there were a building with 1,000 apartments, like,
Sorry.
if there were a building with 1,000 apartments, and 825 of them were market rate, 175 of them were for this community.
Sure. Theoretically, yes, there has been across the city the development of mixed-use housing, which is what you're describing, 80-20, 30-50-20, where a certain portion of the apartments have rental subsidy, and the others don't. Yes.
So there are 1,000 units still to be built here, right? Right down the street, right down the block. There are these 1,000 units across the street that fell out of the Toronto. Couldn't we find a way to apply this? I've lost the number. 57 million.
The 57 million is done. The construction has already started. We are not going back there. What I'm saying is, I'm very interested in talking with you and bringing other people into the fold to talk with you about the future of the 1,000 units, etc.
We were worried 3 or 4 years ago when we were beginning this process, when that $57 million could have been used to take this experiment that was such a success and make it go on.
Well, sir, with all due respect, I've come out to this community and talked about our plans. In fact, Councilmember Latham, I remember Latham sponsored a meeting in this very church. So I've been around. That said, I would prefer that we move forward and not talk about where we were, mistakes, or the chastisement about something being harder. My focus would be moving forward and seeing what we can do together on behalf of the residents at Kohler who will need housing.
Any other questions? Yes, sir.
Kohler was very badly damaged during Hurricane Sandy. It was flooded, and you were out without power for many, many days. Can you talk about what improvements you have made to make sure that you're protected in the event of it? Well, not in the event, but when another Hurricane Sandy does come?
You're correct that the facility was damaged during the Hurricane Superstorm Sandy. Where we are now, just to give you a status update, we have restored the heat and hot water to the power plant here on the island. At one point, when you say it took a few days for us to get a combination of the heat and hot water and lighting, for everyone else's edification, we hooked up external generators and portable boilers to the facility to be able to essentially what we call remain in place. Shelter in place is the disaster term. So we were able to do that. We did, however, move some of the residents from the Kohler cables to Goldwater.